Welcome to
I
another episode of Confabulation. Today we have a special guest, a healthcare professional, who will shed some light on the topic of why quality healthcare is unevenly distributed. If you missed our first episode on this, please go back and listen. I'm Zaire, and I am joined by my co-host, Malik.
Thanks, Zaire. In today's episode, we are joined by a healthcare professional who could tell us a bit about yourself, if you don't mind telling us a bit about your experience in healthcare.
Yeah, so my name is Sadiyah. I am a registered nurse. I've been a nurse for coming up on 3 years now. So I started off working with adults in like a step down cardiac unit. So we saw a lot of patients that had different not healthcare, heart conditions, and went for like minor heart procedures. And then recently I switched into the NICU. So now I work with the babies and little premature babies and sick newborns, and I absolutely love it. And I'm actually interested in pursuing my master's degree. So I plan on going back to become a pediatric primary care nurse practitioner.
That sounds good. And thank you for joining us, Sadia. We are so happy to have you, and you're going to be such a wealth of knowledge.
Thanks. I'm glad to be here.
So I can just start and get right on into the questions. In your experience as a healthcare professional, have you observed racial or economic disparities affecting access to healthcare?
Absolutely. Working alongside a lot of like doctors and nurse practitioners and just providers in general. A lot of the times, like when they're educating patients on how to like take care of themselves and how to take care of like whatever condition they have, you often hear them say like, make sure you're getting your routine checkups, have, lifestyle changes, which often includes eating a better diet and, incorporating more physical activity. But to the average person like you and I, we forget how much of a privilege that is, right? For me, I literally live right down the street from two major hospitals. There's literally a Publix right across my street. But for people who are at an economic disadvantage, they often live in food deserts. So it's easy for these doctors to be like, "Ooh, have a better lifestyle and have a better diet." But in a lot of these places that these people are at these economic disadvantages, it's a lot easier for them to just go down the street and buy a Big Mac from McDonald's for a dinner versus buying fresh produce and vegetables to try to have this healthier diet, or a lot of the times they have to drive 30 minutes plus just to go to a major hospital. So I feel like that's the biggest thing that I've seen, as far as like my personal experience about this health gap that is so prevalent in my area.
I agree. I definitely sometimes just stop by and like Church's Chicken. Literally before filming, I was like, let me just stop by Church's Chicken and get me some chicken.
It's so much, and it's so sad because it's so much cheaper to, eat these unhealthy things, but the first thing they say, they're like a lot of these cancers, a lot of conditions, they're preventable with a lifestyle change, but it's so much easier said than done. Especially if you don't have that economic disadvantage. If you have the money to, go to Whole Foods or go to Trader Joe's and buy all these healthy things, or, go down the street to a clinic to get your checkup done. Like it's such a privilege, and we forget that.
Yeah, definitely harder to maintain, easier said than done.
For sure.
Yeah, so it's interesting how you mentioned like the food deserts and like the food options that are available to us, like the fast food. Do you mind sharing more like key factors that you believe are that contribute to the disparities and how they manifest in the healthcare system?
Yeah, for sure. I would say lack of education is a big
Mm.
one, which I feel like correlates with lack of resources. A lot of these people just don't know. And I feel like they're not getting the proper education that they deserve. A lot of the times, if people live in a place that's a food desert, 9 times out of 10, it's also, they don't really have many great educational resources. So those just got to go hand in hand. Another thing I think is low income. A lot of low income families are uninsured. And I often see where, people come in and they see that they're not insured and they get turned away, so I definitely see it manifesting in that way. So if I had to like narrow it down to like the three biggest key factors, I would say lack of education, lack of resources, and lack of income. or just low income in general, you know?
Yeah, I feel like as things are being inflated, there's not enough salaries or paying their employees that are being inflated as well. So it causes a lag. I mean, and then you're kind of stuck in between like, do I pay my bills or do I have quality food to eat? Or
You
can I
know?
miss a day to go to the doctor's appointment and get this preventative screening? Or I really have to work to do X, Y, and Z.
Exactly. We are definitely in a recession. And, I live in the Atlanta area. It is expensive to live everywhere here. So by the time you finish paying your rent, which should honestly be a mortgage, it's like, okay, how much money do I have for groceries? Okay, well, I don't have that much. So let me buy some ramen to get me through the week. Let me buy a box of cereal for breakfast. Like, it's crazy. It is crazy.
Yeah, and you can't even account for how much you're going to spend on gas to get to and from work, and gas is high. It's just it is.
Okay, everything is so expensive. Like, and so many people are living in survival mode nowadays, unfortunately. But
Yeah, yeah. Could you share any specific examples or stories that highlight the impact of racial and economic disparities, like on a patient's ability to receive adequate healthcare?
yeah. So I can actually get really personal. I have an uncle who he lives in Section 8 housing in South Carolina, and he's raising 3 kids by himself,
Mm,
right? So there was a situation where his toe got infected and it became narcotic. um, or necrotic, which means that like the flesh is literally dying. It's turning black and it's dying. So he needed to get it amputated, or he needed to get it cut off. But he lives like 45 minutes away from like the biggest hospital in his area. So by the time he went to finally get it checked out, like it was pretty bad. Like there was no saving it. And that was just like a huge culture shock to him. Like, oh my goodness, I've lived my entire life with all of my extremities, and now you're telling me that I have to get something cut off. Like, this was new to him.
mhm.
So they tried saving it, but there was no saving it. So he had to get it amputated. And a lot of the times I feel like people of color, or just minorities in general, aren't receiving the proper education within the healthcare system, right? So it's like we go to the hospital to get treated, but it's like, are you being educated on how to take care of yourself once you leave the hospital? A lot of the times you'll hear patients say no. Like, okay, they're telling me like, oh, this is what I need to do. They give you a piece of paper, they give you some medications, and you're out the door. And that's kind of what happened in his scenario, unfortunately. He left the hospital and he wasn't properly educated on how to treat his newly amputated toe. So the infection unfortunately ended up spreading to his leg,
Oh my
and
God.
he waited, to get it checked out because he wasn't close. He didn't have transportation. There was transportation issues. And like I said, he's not close to any major like clinics or urgent cares where he can get it checked out. Like it's a drive. And then he has 3 kids that he's raising on his own. And he lives in Section 8 housing. So it's like, it's just one thing on top of the other. So he finally gets it checked out, and they're like, yeah, this infection had spread. So he ended up having to get his whole leg amputated. And I just feel like that just goes to show how like this situation is so multifaceted, and there's so many different levels to it, and there's so many different things that contribute to this health gap, and that contribute to all of these like racial disparities that we see within the healthcare system. So like I said, and that happened pretty recently. So that is something that hit close to home. But even like in the hospital, like I said, people are getting treated, but then they're like, okay, the doctor just came in, said a bunch of whatever, like, and they're not even talking to them on their level. We use a bunch of what I call like nursing jargon, where it's like, okay, we're talking and like we might know what we're talking about, but the patient who might not, be educated well enough, or, doesn't have a great educational background, which isn't their fault as well, like they might not understand what we're telling them. So you have to, get on their level and educate them on how to properly take care of themselves. But unfortunately, you're not really seeing that a lot of times in
Mm,
minority groups.
wow. Yeah, I'm sorry to hear that about your uncle. That is crazy.
Yeah, and that's just one story of many, one story of many. And I feel like minorities kind of get the short end of the stick in the healthcare system. But luckily I feel like there are a lot of things in place, and I feel like, even though we are making improvements and we're making strides to be better, we still have so much work to do.
Agreed. And I definitely will say that on all fronts. I think there is a lot of work to be done.
Yeah.
Yeah, and I think like education can be like preventative healthcare. Like if you can educate people on how to like protect themselves or go get help when they can,
Right.
it can prevent like a lot of like further illnesses and like furthering of the disease. So
Mhm.
how do you think preventative healthcare can play a role in reducing healthcare disparities? Like, how does inadequate access to preventative healthcare screenings contribute to like the unequal distribution of healthcare?
Yeah. Um, well, to make a long story short, I feel like if you don't have access to these preventative screenings that are so important, it can lead to a late diagnosis.
Mm-hmm.
And I mean, that's
Yeah,
kind of like the simplest answer that I can give. Like, if you have a condition but you're not getting screened for, you're not getting tested, it's getting left undiagnosed. You're not getting treated, so things can spread. They can metastasize. They can get worse, and the whole time you don't even know. And you might notice certain symptoms, and a lot of times I feel like people do notice, but they're either scared to go to the healthcare, they're either scared to like go to a healthcare professional, or they don't have access to it. They have transportation issues, like all of these things. So it can definitely lead to a late diagnosis, which just leads to like a bigger storm of it being a lot harder to treat, or it's even irreversible. And it's like, okay, it's stage 4 at this point. There's not much we can do besides comfort care or hospice, or try to prolong your life as much as we can. But I feel like preventative screening is definitely important, but if you don't have the access to it, you're not getting it. And a lot of things can be misdiagnosed or diagnosed too late, which is unfortunate.
for sure. And like if you see something like today, like something that seems like could be something that you want to get checked out, and then you're working like 3 jobs, and then you have it's a 45-minute drive. So like when do you really get the time to get it checked out? And then maybe you get an appointment, and if it's a hospital that's 45 minutes away, it's probably a really busy hospital because a lot of people are trying to
Mhm.
get to this hospital. So you're probably gonna have to wait even further to like get it checked out. So it sounds like a
Exactly.
challenging position to be in.
It is. It's like a loophole, and I've seen where like patients, they'll have specific appointments set up, but then they can't make it or they miss it. And then we're like, oh, what happened? It's like, oh, my kid, something ended up happening with their kid, or something at home, or they just couldn't find a ride. It's too far. So luckily, um, with the hospital that I work at, we have resources to help patients like those. So like, we'll give out gas cards, we'll give out MARTA tickets and bus tickets and whatnot to try to help. We'll even help patients catch an Uber if we need to, but we get like care coordination and case management involved and whatnot. So and I feel like that is a thing in a lot of hospitals, is that we try to provide these resources to families that need them. I just wish that they were more easily accessible and that we were able to provide it at a bigger rate, because we have limited resources. So we do have to kind of like, keep
Yeah.
that in check. But um, yeah, I just wish we had more of those resources available to a lot of more patients that needed it.
Yeah, you literally segued into my next question on if you guys had any successful initiatives or programs that could effectively address that disparity of getting the preventative healthcare screening. And I think it's awesome that you guys give out gas cards and MARTA cards just
Yeah,
so they can get to their appointment, because I think that if you can catch it early, it's probably the best.
right.
And it avoids a lot of other things that can potentially happen and fall down the line.
Yeah.
Um, Definitely.
And like even because I went to Georgia State, I did some of my years at Georgia State, and then I went to nursing school at Augusta University. But on both college campuses, like there was a lot of programs and initiatives that were under the CDC that would come out to our school, and like they would talk to people in the community, educate people. And one of the biggest ones that I've seen was Truth. I don't know if you guys are familiar with Truth, the initiative Truth, but their main goal is to educate young adults and adolescents on the truths about the tobacco industry and like the effects that smoking and vaping, things that, you know, are so cool nowadays to do, but like the negative effects that it has on people. But not only are they striving to like educate people, but they're also striving to encourage individuals to like go out into the community and make a change. So there's definitely ways to get involved. And like, even if you can't like work for these programs or work for these initiatives, there's ways to volunteer. There's ways to donate, you know, see what you can do in your own community. You know, it's so easy to do things on like, you know, up here, but like I said, I think there's things that need to be done on every level. So even community outreach is important. So
Right.
there's definitely a lot of programs and initiatives that I have seen on my college campus, but like I said, I feel like there's always room for improvement, but I definitely think we're making strides in the right direction.
I agree. So how do you feel about mobile health clinics?
Mobile health clinics, you know, it's crazy because I don't see too many. I'll see like a lot of like blood drives, you
Right.
know, so like I've seen that. Even when I was in high school, you know, they would come out. I've seen a lot of like mobile STD clinics, so like clinics that'll do rapid HIV testing and so yeah, I've seen them. I haven't seen many of them in my area, but I think that's also a good thing because I live in Atlanta. So it's like, you know, that we have a lot of access to hospitals and whatnot, but I'm hoping these mobile clinics are getting to those communities that need it. And I haven't done much research on like the effectiveness of these mobile clinics. I think they're great though, and I hope that they're working, and I hope, you know, they're actually making an impact, because I think that, you know, that's something that we do need to see more of, because there's so many places that are in these deserts, these food deserts, and they don't have access to, you know, an urgent care clinic. Like, even though an urgent care clinic, like say if you need like a major procedure done or like specific medications, you can't get it from there, but at least you can see somebody that can tell you to go there or can refer you to another specialty. So, but a lot of places don't have that, don't even have simple clinics that you can just walk into and, you know, talk to someone. So I think mobile clinics providing that is a great resource.
Yeah, I'm for it 100%.
Have you guys seen mobile clinics in y'all areas? Like, do y'all see like mobile clinics where y'all are? Because I don't really see, like I said, I also live in a very populated area, so I don't think they would be around here a lot.
I don't really see it in my area. I'm closest to the airport, so
Mm, yeah.
Yeah, I don't see it in my area either. I live, I guess, in a populous area too, South Florida, but I don't
Yeah.
see much of them.
Yeah, me neither. Like I said, I hope they working. You know, I hope they're out here doing what they're supposed to do, because I definitely think it's a great thing to have in underserved communities.
definitely. I think it will also help with the um our homeless population here in Atlanta. I think having those mobile health clinics drive up and help them with whatever they need um will be a great help, because I know that some homeless people will go to the hospital and they're just happy that they have a bed to sleep in and they're getting their food
Yeah,
for breakfast, lunch, and dinner.
a
So
place to rest
I
their
also
head, like, you know.
yeah, so I think that it will be very beneficial to them to help them out in any way that they need.
Hmm.
I actually have heard of like, I guess not mobile clinics, but like I'm not sure exactly what it's called, but it's like where they'll have people from the community come in and they'll sit and like listen to like a doctor or presenter like give education on
Hmm.
like
Yeah.
common health issues like hypertension, stuff like that. I
Yes.
think that's something that could be very impactful. So like people get to like hear, like see, like and can probably see examples of how it can affect them. Um,
Right.
have you?
And then,
Do
you
they have
know,
the? Go ahead.
go ahead.
Oh no, no, I was.
And I was just gonna say, like, I love how you said that, like, these doctors will come out and talk to people, because I have seen where, like, you know, people's definition of community outreach is just like going out with a little table and handing out pamphlets. I'm like, it's 2023. You got to be more engaging. You know, you got to get people. You got to meet people where they're at. And a lot of people aren't gonna want to just read a pamphlet. I know me. If you hand me a bunch of paperwork, I'm not gonna want to read it. I'm not gonna want to look. I'm like, what are you giving me? This is boring, right? So the fact that these doctors are like actually coming out and talking to people. Or like I said, even with the Truth Initiative program that I've seen, like they would come out and host events, like they would have whole little like carnivals and like health fairs and whatnot to make it engaging, make it fun. Because that's how you're going to grab people's attention, and that's how you're going to make a lasting impact versus just handing someone a flyer saying, read this and educate yourself on it. So good to hear
Yeah,
that.
and you mentioned the medical jargon that probably are in these pamphlets. Like, imagine not taking a
Yes,
biology class before and then seeing all these words and being
exactly.
like confused. I would be overwhelmed by it.
Yeah.
Um, but have you seen, I guess, any other programs in your area, probably at your hospitals, that helps with this issue of like healthcare disparities, like um, that can effectively address preventative healthcare?
Yeah. Um, I know with because I work at Northside Hospital, they have a really big women's health center. So a lot of times they'll have events, or they'll go to events where they'll educate women on self breast examinations, which is really important to prevent, or try to catch, breast cancer in women that might have it. Or it's crazy because I actually read something off of the American Cancer Society that was talking about how even though Black women are less likely to get breast cancer, they're at a
Mm,
higher risk of dying from it. Right. So, say if you have a group of Black women and you have a group of white women, more of those white women might have breast cancer, but less of them are going to die from it. Whereas if you have a group of Black women, a handful might have them, but those handful of people are more likely to die from it because they're not having access to timely care. So something that my hospital would do that I've seen is like they'll go out and they'll educate women on signs and symptoms of like, abnormal things to see, or, abnormal things that you might come across. And like I said, just the importance of self breast examination. So that's something that I've seen recently that they've initiated, which I think is great. So, um, yeah, I hope more hospitals do things like that because it's very important.
that also reminds me of, I think at my church they used to like bring in like presenters, like maybe a local nurse or doctor to like come in like during the service and then like um, talk about these common healthcare issues. And and I guess in this way, there's more people that are able to come out, and they have a set time, like on the weekend, to listen to these things.
Yeah. I said education is so important. So like I've been to a couple of like college fairs and high school fairs of just like different healthcare professionals come in and not only talking about what they do, but also talking about like what they see in their own community, but also encouraging people to make a change as well, um, in whatever ways that they can. So I think it's really cool.
I think so too. My next question is, I know that you work at a super busy hospital.
Mhm.
Um, and I know that you're getting like all races that come in and out of those doors. And I just wanted to know, like, is there a language barrier sometimes when you're talking to patients that are speak a different language, or do you guys have those nurses on hand that can reiterate and better explain the things that are happening?
Yeah. So, because we're in Atlanta, like you said, we're coming across people of all races, ethnicities, and people that speak all different languages. So one of the resources that we have is we actually have a lot of iPads that like are on little stands, and we'll have like literally every floor has a set amount of these iPads that have an app that we use that we can get a interpreter on the line.
Hmm.
So I know during the day, because I work night shift, during the day we'll have like live interpreters that can come. But at night we don't have that. So we have our iPads. But like I said, even these iPads and the apps that we use, like there's like several different language interpreters that we can call. Which, like I said, I'm in the NICU, so I work very closely with labor and delivery and just the women's center in general. So I've been in deliveries where, like, someone who is speaking a completely different language is like in the middle of their first C-section, and that's scary. And, sometimes, the doctors, they're just like so busy doing their own thing that they're just like, they're on go. And I'm like, can we get an iPad? Like, this person does not speak English and y'all are just over here. And like, that's a very scary thing to go through, like going through a C-section and like people are just talking and you don't know what they're talking about. So,
Wow.
you often have to advocate for your patients and be like, let's get an interpreter because, this is something that needs to be interpreted, so that they know what's going on. But we have that. And then we have classes, like we'll offer CPR classes to our patients. So that way, if they, feel like they need it before going home for their baby or even for themselves, like we offer CPR classes not only in English, but in different languages as well. So those are just some ways that we try to combat that issue of, dealing with people that have or just speak different languages in general, but are still looking for good healthcare.
Right.
I'd like to know, considering like we said, the multifaceted nature of healthcare disparities, what steps can be taken at both the policy and community levels to bridge the gap and ensure more equal distribution of healthcare?
Yes. See, I love this question, not only because the question itself is great, but like I think it addresses a common topic that we've talked about, how like
Yeah.
there's something that can be done at every level, like both the policy level, the community level, within our own communities, within our own homes. So I like to emphasize that. I'm like, wherever you are, you don't have to be a healthcare worker to make a change. You can make a change starting in your own family, starting in your own community. So there's definitely something that can be done at every level, but something that can be done on a policy level, making healthcare more affordable. Like, let's start there. Because it's so sad. Like, there's so many people that are uninsured and are just out here with no health insurance. And I'm just like, health insurance, I think, should be like a basic human necessity. So the fact that people have to pay an arm and a leg to receive adequate health care just does not make sense to me. So I feel like putting people in positions and putting people in roles that align with, like, if that's something you're passionate about, if you're passionate about policies that make healthcare affordable, vote for people that have those same that same agenda as you. So that's something that we can do. It's like, I'm not super into politics, and I can't by myself make a law, but like I can vote people in place that align with my values. And then just bringing more resources to our schools, because like I said, I feel like education is so important. If you can educate somebody, like you're giving them a wealth of knowledge. And we've all heard that line where it's like, you can feed somebody, but if you teach a man how to fish, he can feed himself for a lifetime. It's like, let's teach more people how to fish for themselves. Like, let's not just give them these things, but let's educate them. So that way they're making better choices down the line. They're teaching their kids, they're teaching their friends, their family, because I feel like we downplayed the impact that word of mouth have. So it's like, if you educate somebody, they're going to educate somebody else, and it's just going to, create a snowball effect. But we got to make those resources easily accessible. And like I said, it's 2023. We got to make it engaging too. Stop handing out pamphlets. I don't want to read a pamphlet, and I'm a nurse. Like, you know what I'm saying? I hate when we just like, oh, let's make a pamphlet. Like, no, like if you're going to make a pamphlet, make it appealing, add pictures. I'm a visual learner, and like I said, the Truth Initiative, they come out and they're not just handing out things, but they're throwing events, they're throwing cookouts, they're throwing carnivals so that people can come out and enjoy themselves, but also get educated in the process. So I think we need to be innovative with our approach. And, like I said, just working on educating people, getting into the schools, getting into the communities. Even like my apartment complex, like they'll have people come out, and I'm just like, well, I never even thought about that. Like just having someone, come in for 2 hours, and if you have questions, or, they'll offer like pregnancy tests, they'll offer condoms, they'll offer, rapid HIV testing, like get out into those communities. So like I said, I feel like there's something that can be done at every level. The possibilities are endless. We just have to work on actually doing it,
Yeah, I feel like we have so many resources. We have TikTok, Instagram, Twitter. Like there's so many different platforms that we can
Yes.
use to promote a healthy living and promote preventative care, as well
Mhm.
as you say, like when it starts inside the home, like,
Right.
and not just basing things off like, oh, it's genetics to have high blood pressure. No, it could be what everybody else in the family is eating.
Right. And it's like we
um
grow up on this, right? Like
yeah,
my family was really big on ramen growing up, you know? And it's for me to be like, there's a lot of sodium in this. Are y'all aware of that? Like, you know, and we would just eat it for like lunch, dinner, 3 times a week. Like these are things that are like embedded in our culture. So like you said, a lot of people just think, oh, it's genetics, it's hereditary. It's like, no, what's hereditary is the lifestyle choices that we are continuing in our family dynamic, you know? So
exactly.
yeah.
Um, I think I have another question. Are there any promising trends or strategies emerging in the healthcare field that give us hope?
Yes, I think, like I said, I want to be a nurse practitioner. And I've often heard that like nurse practitioners are oversaturated, like there's so many of us, and you know, it's becoming oversaturated and they're not being hired in the hospitals. And even though some people look at that as a bad thing, I'm like, that's good. Like, you know, you don't always have to work as a provider in the hospital. Go out to these clinics. There's so many NPs that are opening their own practices. And, you know, when they're opening their own practices, that's allowing for more providers in underserved areas and underserved communities. I've even seen things that like certain loan repayment programs, like they'll forgive your loan if you're going back to school to become an NP and work in the underserved area, underserved community. So I definitely think that's a positive, you know, a positive thing that like, you know, we're heading in the right direction. And even though some people are like, oh, NPs are oversaturated, I'm like, good. That means that like there should be no reason why we're not seeing more clinics pop up in the next couple of years, you know? So I'm looking forward to that and just seeing how that changes our communities and just getting more providers out to these underserved areas, you know? So I think that's a promising thing,
Yeah, I agree.
you know?
Back to, I think you mentioned the ramen. There just reminds me of college, like when they were passing out ramen. I was like, you keep your ramen. I'll have my oatmeal, um,
Okay.
and just add some protein, and then that thing will stretch compared to
Mhm.
all the sodium that you get in ramen.
Yes.
Yeah. Well, thank you for joining us today, Miss Sadiyah Ali. Before we conclude, do you have any final thoughts or recommendations for our listeners who are passionate about addressing these healthcare disparities?
Yes. Like I said, I think the biggest thing is like if you're passionate about it, don't get discouraged from what you can't do, right? Because this is a big issue and it didn't happen overnight. It's not going to change overnight. But if you're passionate about it, there's something that you can do. And I feel like as an individual, yes, you can make a change, but I feel like we make bigger and more impactful changes when we have more numbers, right? So don't feel like you have to conquer this issue by yourself. There's so many clubs, organizations, initiative programs that you can volunteer with that you can combine your resources and tackle this issue. So if there's someone that's like, oh my gosh, this issue is so much bigger than me and like I can't do it by myself, you absolutely can't do it by yourself. But there's a lot of people who are in your same position, who have the same passion and the same drive as you. And if you get with those like-minded individuals, like together you can make a change. You know, like I said this plenty of times throughout the interview, there is something that can be done on every level. You don't have to be the CEO of CDC to make a change, right? You don't have to be the president of this or the head honcho of that to like make a big impact. There is something that can be done on every level. So I think that's the biggest message that I want to send to anybody who's like watching this interview, watching this podcast. Like there's something that you can do. And like I said, it starts within our own family. You know, I think it's like when I became a nurse, I almost forgot to turn around and look at my own family and educate them on the things that, you know, they're not doing right or the things that they can
Mm.
improve on. You
Yeah.
know? So don't be afraid to look inside your own home, look inside your own friend group and start there if you don't know where to start, you know?
You spoke it, girl. I like it. Um, Again, we are from Our Sister's House, which is a domestic violence advocacy and education organization. If you or anyone you know is experiencing domestic violence, you can call a hotline 253-383-4275 or visit our website at oursistershouse.com. Thank you, Sadiyah, for joining us.
Thank you guys for having me. It was such a good talk, and I love what y'all are doing. Keep it up. And like I said, I think this is just one major step in the bigger scheme of things. So you guys are doing great work. Keep it up, and thank you for having me. It was a pleasure being here.